Today I hope you can see everything. Much for this invitation. Good morning from Athens. Now it's around 10 o'clock. And my talk today in this TechNova conference will be relevant to the previous one in digital healthcare, but here we will focus on AI and machine learning in optimizing healthcare services. It's not only, let's say, the digital healthcare, but it's a part of it, the most critical nowadays, because what seems is that AI is revolutionizing our lives and will revolutionize also healthcare in all aspects. We will see together some issues on advancements and challenges in healthcare. About the AI explosion, is really a hype or not hype, a reality? Actually, the answer is it's reality nowadays. And we will see certain important applications of AI and machine and deep learning in healthcare systems. So this comes also from my book here, together with my co-authors, about revolutionizing healthcare AI integration with IoT for enhanced patient outcomes. Of course, with IoT, the Internet of Things, we include also robotics. We include, because robotics is a system of sensors, an integration of sensors and computing. And of course, mechanical engineering, because we need degrees of freedom in movement of robots. So actually, we say here that robots, together with AI and sensing systems like IoT, will revolutionize completely healthcare services. Now, why machine learning in healthcare? What makes healthcare unique? We discussed with the previous presenter that healthcare, of course, is a very important set of services for people under that need care, let's say, care for illnesses or for whatever. What is unique is the complexity of issues, is the need for true intelligence in order to help people. We are not, of course, in the face of true intelligence, but we are mimicking intelligence with AI. But we are mimicking intelligence with lots of potential. So healthcare is unique because apart from intelligence, it needs also human-like sensing of things, consciousness, many other things that do not exist in nowadays intelligent machines. So from the beginning, healthcare, yes, is unique. AI will help a lot to revolutionize everything, but humans are not replaceable. Not only nurses, doctors, no one is replaceable because the machines do not have any consciousness. We are very far from this. And apart from the fact that we need to supervise the machines, we need also to debug, to see the problems, to see improvements, the doctors have the principal role. So don't expect that AI is here to replace anyone. It's only here to assist everyone. Very short, in 2 minutes only, the beginning of AI in healthcare started in 1970s in Stanford with a MySyn, an expert system about diagnosis. So the diagnosis was for many diseases. I don't have time to show all diseases, but there were actually around 500 diseases near 70s and 80s. Remember that at that period, we didn't have full standardization of diseases, symptoms, and variables in general. So you can see a probabilistic model of 80s used 570 binary disease variables, therefore 570 diseases. It seems a lot, but it's not a lot. 4,000, around 4,000 symptom variables, and all this, you see the diseases, flu, pneumonia, diabetes, and whatever you can imagine here, 570. And here are the symptoms. So the probabilistic network was, the Bayesian network, was able, through proper weights in these edges, 45,000 connections, to decide what happened if the symptoms were this, that, and that. There were many problems since the clinicians entered manually the symptoms. Nowadays, we can alleviate such problems. It was very difficult to generalize, very difficult to maintain how to play with the edges here, the variables, etc. These were not possible to be really applied. This was only for demonstration in universities, in research centers, etc. But during also that period, we had a lot of advances in automating medical discovery. So again, from features to, but even in an unsupervised way, from features to discovery of new, important, let's say, advanced features in order to help the doctors decide. In the 90s, we had the neural networks. The neural networks, which is actually my field since 1995, were able, in nonlinear and probabilistic ways, to give very good results regarding medical diagnosis. Not better, however, than experts. The problem, such models, was that could not in the clinical workflow. Actually, clinician could use such models. And the generalization was not so good. You can see here a number of examples in neural decision making, what kind of networks we used, and what were the diseases. You can see also how many cases for training and testing, etc. The problem, as you understand, was data. We had very limited number of data. You can see here how a network can decide about breast cancer, training 57 cases and testing 20. This is joke. This is toy. Remember, this was 30 years ago. You can understand the evolution nowadays since we train the systems with millions of records. This is possible because of the cloud system, big data, and of course, the superb power of NVIDIA GPUs and AMD GPUs, not to advertise only NVIDIA, AMD is very good too. And of course, new processors, therefore, new computing power, immense computing power, if you compare with the one 30 years ago. 30 years ago, we had the Pentium processors running in some 1, 2 gigahertz and no memory, let's say memory was not one, nothing could. Hard disks were very few gigabytes. Now we have terabytes and more. So why now? The explosion of data from hospitals. Everything is digitalized. So you can see that increased this since 2010 around. In 15 years, we have increase of data. Why? Why? Of digital healthcare we discussed previously. So now we have data, not very clean data, need very good processing, but in any case we have data. We have very data set, so anyone can train his method, test his method, her method. So we understand, and this talk is about ECM, therefore the healthcare management. So even in this case, we have critical care patients in large data sets. 4K critical care patients, if you other patients go to millions. Data sets. You can see that in USA, for instance, we have 230 million unique patients since 1995. Nearly all population, but we understand it's not only in West, everywhere we have such kind of data sets, large data sets. So electronic healthcare provides the capability to collect huge data in order now to train and make our deep learning systems and AI systems efficient in order to deal with difficult cases. Because if you have a very large population, a very large sample, you can train your system in real world data. It's not a toy problem, 100 patients. What is this? Nothing. But what kind of data do we have? We can see that kind of data range from lab tests, lab data, to genomic data, all potential to understand the also not only imagine signals of any kind. Social media. Why social media? the comments, all fora, all discuss about symptoms, about treatments. Do you understand what is social media? It's a treasure, an ocean, of course, but a treasure. Here we have the experience of patients, and not only patients. Sensing devices, IoT, genomics in general. So the kind of data of any kind. At that period of the 90s, we didn't have such kind of data. Now, why now to use AI? We use the ICD-10 or 9. ICD-9 was ICD-10 is used now in everything. And it's an international classification of diseases. Can you understand how and important is this? And because with standardization, now all methods can be applied who have characteristics of them, dies characteristics, symptoms, in the method decides his way, because previously we could not do this. So diagnostic codes with ICD-10, and of course we have laboratory test codes, pharmacy codes, and all quantitative methodologies is the so-called UMLS, Unified Medical Language System. This is a huge, like expert system, it's a huge system standardizing everything in medicine and healthcare. Now, there is no actually any illness that is not in the system, in the UMLS system. Everything is possible. To improve quantitative methods need standardization. Otherwise, it's something fuzzy. We cannot do many things with a fuzzy, not well described, not well defined problem. Now the problem is completely defined. This is the message here of standardization. And algorithms. Why to use nowadays AI? We are not in the 50s, in the 70s, in the 80s, in the 90s. Then we had simple algorithms. Now we have complex ML, DL, deep learning, and AI algorithms, including reinforcement learning, for making policies, for deciding about policies. So we have semi-supervised, unsupervised learning at large scale. We have experimented a lot in the computing power, the challenges, the open problems, very well, the potential, the metrics, the successes of these methods. We are not blind, because in the period of 20, even 20 years ago, we were blind, toy problems only. Now, real world problems. And of course, all libraries, especially, and many other languages, democratize machine and deep learning. Anyone, from a student to a practitioner, can train a method, can use a method. And I come to the previous speaker notice that policymakers should understand that people cannot use machines without training. Obviously, a lot of tools exist, but this means training of people. Otherwise, people do not have the time and maybe even the opportunity to play with the tools in a fast way in order to use the tool. Means skills. And now, what is a big problem and the big challenge healthcare management with AI is the lack of skills, digital and not only digital, we have also digital skill absence or only few minorities know digital and have digital skills, only minorities. The majority of people have very good skills in playing games in their smartphones. But about real digital skills, there is absence. And I cannot say about AI. About AI tools, skills, we have full ignorance, not skills, full ignorance. So we say about possibility of democratization, but this is a very big challenge. The industry also a big issue. The industry stages from basic research to pharmacy to new drug development can understand. So DeepMind is it's not a tool, it's of tools by Google and could lead clinicians, has the potential to lead in hospitals, but many more things should be created there. Because the Google environment is very beautiful, but only for experts. For people without skills, without digital skills, even using Google Drives, Google Documents, and so on is a nightmare. So you understand, these are tools for seniors only. It's not for everyone. Unfortunately, this is the truth. The big issue here, and this is a main topic of my talk, is the emergency department. It's not there. You know, clinicians and doctors, in the general cases, okay, provided the resources exist in the hospitals, provided, then they can act very well, successfully in general, when there is no emergency. But in case of emergency, where we have limited resources, we don't have many beds for in the emergency department, limited resources. Time sensitivity, we need real-time decision making. Critical decisions, time sensitivity in all things, in care, how you provide, it's not only decision, I have isolated here the critical decisions, time sensitivities for all clinic performance in the intensive emergency department. Limited resources means that we should decide who should be in the bed and who cannot be in the bed. Of course, this is not democratic, but you understand that there, in case of limited resources, the doctors should decide in the best way who needs more, who has bigger problem. But this means prediction analytics. So data in emergency department, of course, emergency. This means information from triads, let's say free text, so free text information, comments, whatever, MD comments, medical comments, consultations, signals, lab results, everything. All this should be degraded. All this should be degraded in order to decide. You understand how a doctor or even a team of doctors how difficult it is to process such big data in real time. It's not an easy thing. We need assistance. And here comes, of course, machine learning and deep learning and AI in general in order to trigger clinical pathways and expedite the clinical pathways. So what is important here is out of the piles of information, ocean of information, to group together things, therefore to build displays similar expert, of course, of the clinician to see what happens. And do you understand how critical is this? So organization of the information in order to decide. This is the most important thing. So triggering clinical pathways, codec-specific displays, as you can see some examples, and we come to here is some opportunities in order to organize the information in even to tick things here according to the information already in. So an intelligent machine can provide based on the data. It's so improving the initial documentation and handling the piles and the ocean of data in order to expedite processes is a big help. Cannot replace, of course. It's a huge help. Risk issue. Risk certification discussion about this issue. Two, for instance, issues. First, the life of mortality, giving a patient with unfortunately the likelihood then who is big from someone else. The question was the likelihood of mortality in the admission. So if unfortunately a patient has high likelihood of mortality, then it consumes the resources of another one who doesn't have such mortality likelihood. You understand how critical and how sensitive is this matter. And we need clear prediction analytics for this. Also, another issue for the persons, the patients that are in the healthcare unit, the intensive healthcare unit, the early detection of severe sepsis. So we need to know if the patient has problem with sepsis. This should be predicted beforehand, before it is too late, as early as possible. So we need real-time predictions based on history of patient and also on symptoms in order to show what will be the possibilities for sepsis or whatever other implication. So this is a big opportunity also for machine and deep learning. You can see also that documentation is a big issue, and what we can gain with deep learning and machine learning and AI is to categorize and improve documentation. For instance, complaints. We can categorize the complaints, we can group them in correct groups, and we can process. Can you understand? In the national healthcare system, you receive millions of complaints. In order to check these complaints, either you need a huge team processing, you need the important thing about intensive healthcare is also the kind of data, the integration of data, and you can see from demographic data, claims, consultation, etc., everything in a temporal manner, because what is needed is temporal modeling of disease progression. So what is the major issue here is to process in time all the information in a fast way, in real time. Why? Because we want prediction analytics not only for the next 1 month, we need even for years. So what is my future? What is the future of patient 1, giving his history, of course, and patient 2, what will be his future? You understand this is a challenge. It's not an easy task for a prediction analytics, but it is somewhat possible to